Hi all, this is Steph Giordano with Human Services Research Institute. Welcome back to the Consumer Survey Review, Part 2 for the NCI AD Refresher Training 2018-19. So we're going to jump right on into the, or back into the survey, looking at questions around safety, security, and privacy. So we left off here with this question 34. Do you have an emergency plan in place? For example, do you or someone close to you, and we added that little addition right there, know what to do in case of a natural disaster, disease outbreak, or other wide-scale emergency. Just a couple of notes here. We are really looking for an emergency plan, so not necessarily just that the person has an idea of what they would do, but there really is a plan. They've talked to somebody, there are steps that they would take, they know who is responsible for making sure that they're okay. In addition, just to help the person better understand what we mean by wide-scale emergency, you may want to think about things that may be specific to where you live, to your state. So whether it could be wildfires, power outages, earthquakes, etc. And separately, we ask if people feel that they can get to safety quickly in case of an emergency like a house fire. Then we have those questions about falling or being unstable, and then some general questions around feeling safe in the home. Questions 41 to 47 are only asked to people who live in group settings. You'll know that based off of oftentimes where you're meeting the person, but if you're not meeting in the person's home, you can also take a look at the background information section to find out the home setting that the person is in. And so we asked some questions around, really largely around privacy and safety in those group settings. People can lock doors if they have enough privacy. They can furnish and decorate their home, and whether they can have visitors come at any time. We also have a few questions throughout the survey, as you remember, about access to food. So this question 46, do you have access to food at all times during the day? So can you grab something to eat or a snack if you get hungry? Just a couple of notes here. We are really looking for the person's ability to grab a snack whenever they want. So the kitchen is always open to get something if they need it, or they can keep food in a pantry perhaps. One other note, if the person is not able to eat because of medical condition, please check off that question or response option 51. That goes for all of the questions around food. You can just go ahead and skip it. So then we go into some questions about the community. Question 48 is specific to having transportation to get to medical appointments when needed. And then separately we ask question 49 whether people have transportation when they want to do things outside of their home. Things like going to visit a friend, going out for entertainment, or do something fun. Question 50 is a new one. In general, do you get to do things you enjoy outside of the home as much as you want to? Then question 51, are you as active in your community as you'd like to be? So this one is a bit ambiguous, and intentionally so. We really do not want to define for individuals what it means to be active in the community. For some people, this may mean that they are not active or involved in the community in any way, and that's how they want, that's what they want. So this would be a yes. For others, they may have had to taper back on things that they've been doing in the community, but maybe for now that's really what feels good and right for them. And for others, they may not be happy with the amount that they get to go out and be involved in the community. So this is one that might take a little bit of following up with the individuals. For those who say that they're not as active as they want to be, or sometimes are not, we're going to go ahead and find out what are those barriers. And this question 52 is a check all that apply. It's also one where we want you to go ahead and read off the response options. Then we get into the question about the various equipment that people may be using. For this question, which is very similar to that about physical environment, it's really important that we ask about each type of equipment and find out for each thing that we ask about if people have the various equipment. We want to know if they want an upgrade or need an upgrade, and if they don't have it, if they need it. So making sure you always do the appropriate follow-up here. Just a couple of notes because there are some newer items here. We ask about a CPAP machine, which is a machine to help you breathe at night, as well as an oxygen machine. Then we get into questions about everyday living, so some questions around employment, if people want a job. People have talked to the individual about job options if they'd like one, if they do any kind of volunteer work. We also have a new question 59. Do you like how you usually spend your time during the day? Question 60 is about the ability to get up and go to bed when people want to. So this means both that nobody else decides what time they can get up or go to bed, and also if the person needs any kind of support to get in or out of bed, that they have that whenever they need or want it. Question 64 starts some questions around health and wellness. So how would we describe the person's overall health? You're going to go ahead and read off these response options to the individual and let them choose what they feel is most appropriate. For question 66, how would you describe your hearing? And question 67, how you describe your vision. Just to note that this is, or both of these are about corrected hearing and corrected vision. So if you know the person uses hearing aids or has glasses, we want to go ahead and find out how their hearing and vision is using those devices. We have some questions about memory. Chronic psychiatric and mental health diagnoses, question 70. This is one where it's really important to remind the person that it's okay to skip questions if they don't feel comfortable answering. Mental health can be something that people are not willing or wanting to discuss, and that's absolutely fine. It's just a good spot to remind people that they don't have to answer questions if they don't feel comfortable. Then we end out that section with a few questions around feeling sad or depressed. Then we get a little bit more into specifics around healthcare access, so if people can get appointments to see their primary care doctor when needed, whether people have gone to the emergency room in the past 12 months, and if so, we want to find out whether it was due to falling, losing balance, tooth and mouth pain. Both of those options we've asked previously, but we've also added this additional follow-up, whether people had to go to the emergency room in the past 12 months because they've been unable to see their primary care doctor when they needed to. Jumping over to question 80, have you had the following preventive care? Before you ask these questions, you just want to let the person know that for each of these items that we'll ask about, there is that not applicable option that a screening or the flu shot perhaps is not recommended. Then we get into some questions around planning. So first we ask for question 83, whether the person's services meet their current needs and goals. This, again, can be a really difficult and sort of ambiguous question for the person to think about. And so you might want to give the person a minute to think about what some of their needs and goals may actually be. You might also want to talk about things that maybe have come up previously in the past bit of conversation. If they say that not all of their goals are being met, or not all of their needs are being met, we're going to go ahead and ask question 84, which is what additional services might help meet the needs and goals. Again, this is a place where we do not necessarily want you to read off each response option, but if the person had discussed maybe needing some additional equipment in their home, maybe there's some lack of health care, you can talk about the things or bring up some of the things that they've discussed earlier and find out if any of those services would be helpful to them. Also, for those who feel that their needs and goals are not being met and who have a case manager, we ask whether the case manager care coordinator has talked with the person about services that may help to meet their needs and goals. And then we ask about some future planning needs. So we wrap up this part of the survey with a couple of questions around independence. Do you feel in control of your life? Again, this is a spot where it's really an ambiguous question. It's up to the person to define what it means to feel in control of their life. We do not want you to try and define that for the person, but this is a space where you might need to allow the person some time to think about what control means to them and give you an answer. And then we have that ranking of those things that are most important to the individual, whether it's health, safety, being independent, and being engaged with community and friends. All right, so for a few of you, this is going to take you to the very end of the survey with the individual. Some of you will go on to an additional module that's around person-centeredness for the person as it pertains to service planning. We'll cover that in a separate module here. And many of you will have some background information items that you'll need to collect from the individual. And again, you would do that now, not before the survey takes place. But once you have all of your information collected for the individual, you just want to do a nice little wrap up to see if the person has any additional questions for you, thank them for their time, and all that good stuff. So let's take a look at Cheryl wrapping up a survey in a really nice way.
Is there anything else that you'd like to tell me that we didn't cover today? Keep in mind, this is confidential and anonymous.
I'm surrounded by loving, caring people. And family and friends. And their support is very important.
Well, that finishes our survey, and I would like to thank you very much for participating with us today. Are there any questions that you have for me?
No, I don't think so. It's been very productive.
So that again is just a nice way to close out the survey with the individual. You'll also want to make sure before you leave that you give the person any kind of leave behinds that your state has. And also remember to fill out that survey or feedback sheet at the end of the survey soon after you complete the meeting. So that wraps up the review of the survey for many of you. Again, we'll have an additional module that looks just at the person-centered questions. For others, we'll go ahead and take a look at when to use a proxy and just some best practices for conducting the survey. Thanks so much for listening.